Contact tracing is taking a case, the person who has the disease is a case, and then looking at the people they have come in contact with that they could have spread that disease to. So if we get a report, we will call the person on the phone usually and talk with them, and depending on what that disease is, we'll talk about who they've been around that disease may have spread to as they're going about their daily business. And with some diseases, you can spread it before you have symptoms, so that makes things more complicated if we're looking at contacts. For COVID-19, because it is spread through droplets, we are looking at people who you've been in close contact with, so people you've been around for more than 10 minutes and closer than 6 feet. So public health nurses have been involved in case investigation and contact tracing for as long as public health nurses have been around. It's an important part of our job. It's kind of one of those hidden things that you don't even know as a community member often, that there's somebody here at public health who's been doing that. For COVID-19, we kind of have a tiered system of looking at who we would consider to be a close contact. So a household contact, somebody that you live with, whether that's family members or a roommate, could be an intergenerational family, those would be close household contacts. And we would want to make sure that we have some communication with them to ensure that they're doing everything they can to protect themselves from getting this disease, which is spread by droplets. And then kind of a next tier, we would want to ask that person that has the disease, who else have you been around outside of your home that might be particularly high risk? So if they've been around people who have a particular high risk, so maybe they visited their grandmother in a nursing home, we would want to know about that so that we could get in touch with the grandmother and or the nursing home and give them a heads up that grandmother may have been exposed to COVID-19 through a visit from a family member. And then kind of a third level would be where people have been, where a lot of people have gathered. So that could be attending special family functions like a wedding or even a funeral, or it could be church or a synagogue or another religious service. So if it's a household contact, sometimes we'll talk to the case about the contact. So for instance, if the case is a parent and the contact is a child, we're probably not going to talk to that child, but we'll talk to the parent and ask them how they're doing. We have a chart that looks at symptoms. So for COVID-19, the most common symptoms are fever, cough, shortness of breath. There can be some other things that come along, but kind of on a daily basis, we'll go through that list and say, is this person experiencing any of these? If the contact is another adult, we'll try to make direct contact with them and talk to them on a daily basis, also reviewing those symptoms, asking them if they're experiencing any of that. It also includes giving them some guidance about what to do if they do start experiencing that. And then also, in addition, answering questions, because you can imagine if you get a call from public health and public health says you are a contact of somebody who has this illness, then you want to know what you can expect. It's usually on the phone and it's usually daily. A person who is a case, that's somebody who has the illness, is asked to isolate. And so there are criteria for them to be released from isolation. And then somebody who has been exposed but is not symptomatic is asked to quarantine. So that is asking for them to stay away from other people, to be by themselves, but they are not sick. So isolate, sick, quarantine, not sick. And so yes, we would ask people to quarantine if they've been exposed, and we ask them to do that for 14 days from their last exposure to the sick person in the case of COVID-19. If somebody goes to a healthcare provider and they don't get a test, but they have the symptoms and the healthcare provider says, I believe this is the illness you have, our public health officer, Dr. Cutler, has actually issued an order that says that person needs to isolate at home the same as if they had had a test. And if they have contacts in their household or contacts in a high-risk setting like a nursing home or jail or another congregate care setting, those people are also under a blanket quarantine order from the public health officer, Dr. Cutler again, to do the quarantine at home. So if you are isolating because you have symptoms, then you need to stay in isolation until both of these following two things have happened. It has been at least 7 days since you began to have symptoms, and it has been at least 3 days since your symptoms resolved, both and, whichever one is longer. If you are quarantining, you need to quarantine away from everyone else for 14 days from the last exposure to the person who is ill. Governor Newsom has issued kind of a 6-point criteria for reopening the state. And one of the things he has said is that more testing needs to be available. We certainly agree with him and believe that more testing will become available as we move into even the near future. And so with more testing that's available, we will have more people tested. And if more people are tested, then we'll have more positives. So we will have more cases that we need to contact, and then they will have more people that they have been around, and that will increase our contact investigations. So we'll have case investigations and we'll have contact tracing, and it will probably, those numbers will increase significantly. And so we are going to need to be very assertive, very proactive in helping the governor to reopen the state by increasing our capacity to do those things.
And with respect to COVID-19, the epidemiologist's role is to support the public health nurses obtain their information from when they do their contact tracing, and then assimilate that into data management pieces and look at where is that curve that we hear so much about? Where are we on our curve in Nevada County when in comparison to the state or other counties around us? We encourage people to go there to enter their information, and the website is 211connectingpoint.org. And on the top, there is a community data link that we would like people to complete their signs and symptoms that they may be experiencing and when they may have had those symptoms. Not only will that help us frame what's going on in Nevada County, along with the reportable diseases that we get from the labs and positive confirmation from those labs and physician's office. This will also supplement what is happening out in our community from people who aren't being tested.